problems with your blood pressure, right?
No.
Okay. Let me just check your pulse ox. See how much oxygen saturation you're getting. Okay. 90%.
Is that good?
Not really. Could be better.
Yeah, I've been doing too good.
Okay, and so I understand that you have an appointment with Dr. Lung this morning, but it's not until later in the morning.
Yeah, I came in, so, right now I'm not feeling good, and I thought it'd be a good time to see a doctor to come in right now. I'm not feeling good. I've been having this breathlessness, and,
okay,
it just progressively seems to be getting worse.
Okay, and so let's talk about the breathlessness. How long has that been going on for?
Oh, it's been going on for a long time.
Okay, what's a long time?
Probably a couple months now.
Okay.
Yeah.
And do you have any other symptoms? So I see that you're coughing.
Yeah, cough I've had a little bit longer.
How long have you had the cough for?
For probably like a year now.
Okay. And do you have, it's productive? Do you have sputum?
Yeah, I cough up some stuff.
Yes. And is there a time of day that it's worse than others?
Oh, yeah, in the morning. In the mornings when it's real bad, yeah.
Is that why you wanted to come in earlier in the morning then to be seen? Okay.
Yeah, I thought it was a good time to see a doctor.
Yes. All right. And anything that you do to alleviate your symptoms? Have you tried?
I just sit down and rest.
Okay. And what causes your symptoms to get worse?
Just, basic stuff, if I go out for a walk or like when I sit down to eat, just anything, if I exert myself.
Okay. You're out of breath. But only with exertion, not when you're watching TV or sitting down to rest. Okay. Yeah. Very good. So I'm going to go over some information in your health record just to update our system. So allergies, I have listed here that you are not allergic to anything.
Correct.
Is that still true? Okay. Yeah. How about medicines? I don't know that you're taking any medicines.
No, nothing.
You don't take any. How about over the counter? Any vitamins? No supplements either? No,
nothing.
Herbal? Okay. And your immunizations. So have you been offered the flu vaccine or the pneumococcal vaccine?
Normally you guys are pretty good about it, but yeah, I don't remember. I don't think I've had it this year.
Okay, because I don't see that we have you have received them from us. You haven't received them anywhere else, so.
Yeah, no, I don't think so.
Okay. And your medical history, I don't have that we have any other illnesses other than the respiratory illnesses that you've had in the past.
I don't come in unless I'm sick, and I don't have anything else. Really.
And you haven't been diagnosed at another facility with any chronic illnesses? Excuse me. How about surgical history? Any surgeries in your past?
Yeah, a long time ago. What was it? My appendix? Had that taken out a long time ago.
Okay. How long ago?
Just like 20 years ago.
Okay. And how about your social history? Are you a smoker?
Yeah.
Okay. And you smoke cigarettes or cigars? Okay.
Cigarettes.
How many cigarettes a day would you say?
When I smoke, it's a pack.
Okay. And how long have you been smoking a pack a day?
Oh, since I was 17, but since I've been sick, since I've been having this, I haven't been smoking.
Okay. And you're 67 right now, and you've been smoking since you were 17, so about a good 50 years then. Okay.
Yeah.
And has anyone ever given you any counseling on smoking cessation, or?
I don't come in too often, so yeah.
Okay. Would you be interested in?
Maybe if we get this cleared up, we'll talk about it.
Definitely help you with that and give you more resources and talk more about it. Okay, and how about history of alcohol use?
No.
Any falls? No recent falls? And any symptoms of depression? No lack of motivation?
No, I'm good.
Okay. And you feel safe in your home?
Yeah.
Okay. And then I have here that you're retired and married.
Excuse me. Yes.
You're still married. Yeah. Okay. Very good. And physical activities. What types of things do you?
I'm retired, so I don't have a lot going on. But I go for a walk. There's a park around the block.
Okay.
Go with my kids or grandkids.
Okay. Good.
Go every day. Try to.
Have you been able to go since you've been symptomatic or feeling this way?
Yeah, not really. I mean, it's difficult.
And how about your appetite? Do you have a fairly good appetite?
No, I do. I mean, I still eat. I want to eat, but I get tired. The breathlessness. I get short of breath when I eat. So.
Okay. And are you still trying to eat the 3 meals?
I'm trying. It's hard.
Okay. Maybe when you're feeling like this, try doing smaller, frequent meals, so that way you don't get as tired.
Okay,
you could try that too. And then how about hydration? How much water would you say you drink in a day?
Oh, I still drink water.
Okay.
Yeah, it helps me with my throat. It's a cough.
And about how many glasses?
How many glasses?
In a day?
Maybe like 10.
10 glasses a day. That's all right. That's pretty good. We'll keep that up because that's going to help you also to thin out those secretions and make it easier for you to to cough them up.
Yeah, my throat feels better when I drink the water.
Yes. And do you have any questions for me?
No, not really.
Okay. All right. So I'm gonna ask you just a few more, and then I'll move on to the physical assessment. How about religious? Do you have any religious preferences?
Yeah, I'm Catholic.
Okay.
I go to church. I mean, I normally do. I didn't go I go on Saturdays because it's nicer.
I like that Saturday evening mass.
Yeah, but I didn't go this last Saturday. I wasn't feeling good.
Okay. And so you generally do go to church.
Yeah.
And then, so we talked about you being married and you do feel safe at home, good relationship with your wife. And I'm sorry if my questions seem personal.
Yeah.
We just like to make sure that our patients have a good support system at home.
That's great.
And you feel like you have that?
Yeah, definitely.
Good. Okay. So, let me make sure that I've covered all my bases here. Really quickly, any problems with urination?
We go to the restroom?
Yes.
No.
Okay.
No.
No problems with that. No problems with sexual dysfunction.
No, I'm fine.
How about bowel movements? You're having regular bowel movements?
Yeah, going normal.
Any constipation or any diarrhea?
No, normal.
Okay, good. And then once again, the symptoms that you're having. So I see the cough, and you have it's a productive cough with the sputum, and it's like a clear white sputum that tends to be worse in the daytime, causing you breathlessness as well. The breathlessness that you have with activities only, right? And so let's talk about the distance of walking. Is it like from your bathroom to your bedroom, or is it
that I get tired?
Yeah,
in the mornings is when it happens a lot, and it could just be regardless of what's going on,
Okay. And let's see. And then you've been feeling tired also, right?
Yeah.
Because of the symptoms that you've been having. Do you... So, we took your weight earlier. Have you lost any weight?
A little bit. Not.
It's just a little bit lower than our last time.
Yeah.
Okay. Do you monitor that at home?
No, I really don't watch it that well.
Okay. Well, when you're sick especially too, just... If you have a scale at home, use it. Maybe try it weekly.
Yeah, there's one in the
monthly.
bathroom. I don't mess with it a lot, but
okay, but check your weight because that's a good thing.
Okay.
Let's see, occupation. When you I know you're retired, but when you did work, were you around a lot of cigarette smoking? Within the workplace.
Yeah, just the normal stuff. Guys, nothing crazy.
Okay. Just with your dad, you said you had mentioned he was a lifelong smoker,
Yeah,
right?
yeah.
Okay. And then we talked about the family history already too, right?
Right.
Okay. And so going back to occupation, did you work around chemicals or dust, any pollutants in the air? And this could be indoor or outdoor.
Nothing really stands out. I mean, I've had a lot of different jobs, but nothing that I could say, hey, that might, nothing that I could think of.
Okay. All right. So do you have any questions for me, Mr. Manolo?
No. I'm
All
good.
right.
Thank you.
So I'm going to start by asking you for your name. This is part of our examination.
Mr. Manolo?
Okay. And what is your date of birth?
10/19/49.
Okay. Very good. And do you know the time of day right now?
Yeah, it's in the morning, so it's like 9.
Okay.
8, 9, somewhere around there.
Yes. And then where are we at right now?
We're in downtown Tucson.
Okay. And do you ever feel that you get confused at times or forgetful every now and then?
Yeah, a little bit. I mean, just getting older,
Okay.
Yeah.
Does your wife comment to you?
Yeah, things change. Yeah.
She'll be the one to let you know if something's going on, huh?
She does. Sure does. Let me tell you.
Good for her. Tell her I said hi when you
Yeah,
get
I
back
definitely
home.
will.
Okay.
Thank you.
So I'm gonna go ahead and start with the assessment. It's a good thing you came in earlier than usual, then, huh?
Yeah, definitely.
Okay, so let me just clean my hands up first. And so I'm just gonna look. I'm gonna look and listen and feel in some areas. You tell me if you experience any pain, okay?
Okay.
All right. Do you need a new tissue?
No, it's hanging in there. I think it'll be fine.
Because we have more right over
I
there
believe
if you need
do.
some, okay?
Yeah, no, I'm good. Thank you.
All right.
Appreciate the offer.
You're welcome. Okay. So first thing.
Excuse me.
And you stop me at any time if you feel like you're gonna have a cough attack,
on
okay?
You? Yeah.
All right, so I'm going to take a look at your eyes first. So if you just stay looking at my nose. Okay. Good. And then, very good. Take a look right here, and only moving your eyes, follow the tip of this pen light. And no pain in your head? You haven't had headaches?
No.
Okay. Do you wear glasses?
To read.
Okay. I'm going to go ahead and take a look in your ears real quick. Okay. Any pain?
No.
Well, you do a good job of cleaning those ears out.
Oh, yeah.
Okay. I'm going to go ahead and take a look up in your nose, all right? Okay. And now if I'm going to look in your mouth, and I'm going to use a tongue depressor, so
Okay.
I'm sorry if I make you gag, but
Okay.
that's typically what's supposed to happen.
Okay.
Go ahead and say, ah.
Ah.
Okay, sorry about that.
Yeah, okay. Good job. Thank you.
All right, but that's a good sign.
Yeah.
Gag reflex works.
Yeah, it does.
Okay, so now I'm gonna just feel around on your face, just in some sinus areas. You tell me if you're having any pain.
Okay.
No pain in here.
No, I'll tell you.
Do you ever get pain like at the top of your jaw, like the gum line rather? And no pain in the.
No.
Feel the neck real quick. Any bumps that you felt in the neck? Any swollen? Looks good. Good. The veins look good. Everything's looking the way it should so far.
Good.
All right. So on your face again too. I just want to see both sides are moving together nicely. So if you'll go ahead and raise your eyebrows and bring them back down, good, and smile big for me. Open your mouth and stick out your tongue. Move it side to side. Okay, very good. I'm gonna take a listen to your lungs next. Okay. Okay. Go ahead and take a deep breath. Again. Good. And if you'll sit forward. Okay. Again. Again. And again. Good. I'm going to take a listen to your lungs, or to your heart. So go ahead and breathe normal.
Okay.
Good. And if you take another deep breath. And again. And again. One last time. Good. So next, since I'm listening, I'm going to go ahead and take a listen to your belly. Okay.
Okay.
So do you feel like you have to cough up right now? Because your lungs are a bit noisy.
Yeah, just...
Okay.
Yeah. Keep coffee.
Okay.
Sore, it's,
Sore muscles from the coughing. That happens, yes.
Yeah.
Okay. And if I can just go ahead and touch right in the
Sure.
belly. I just want to be sure that everything is good here. No pain?
No pain.
Okay. And the belly is not bloated. It's good. And so when you talk about pain with your ribs, is it generally in this area or?
Yeah, it's it's right here.
Okay, just from the coughing.
Yeah, just from the coughing.
You know that you can break a rib if you cough hard enough?
Really?
Yes. So definitely say something if that's the case, okay? All right. So the next thing I'm going to do, I'm going to have you stand up with your back to me.
Okay.
And I'm going to check to see, I just want, what I want you to do is I want you to say 99 as I place my hands on your back, okay? And you're going to be saying it multiple times.
Okay.
All right, I'm just feeling for vibration here. Go ahead.
99, 99, 99.
Okay, very good. And so the next thing I'm going to do is I'm going to take off these gloves. I'm going to percuss. And I just want to listen for dullness or just to see how it sounds when I tap right here. And the same thing from the front. You okay so far?
Yeah, I'm good.
All right, so I just gotta feel right here in between your ribs. Okay. Okay, go ahead and have a seat. Do you have any questions for me so far?
No, I'm good.
All right. Okay, Mr. Manolo, so the next thing I want to take a look at is your strength. You feel like you've been weak? You feel like you're losing any strength lately because of your illness?
No, I think I'm okay.
Okay, so go ahead and take my hands. I want you to squeeze as hard as you can. Okay, good. Go ahead and lift your arms up. Good. And let me go ahead and take a look at your feet. Bring your hands down. Okay, so stretch out your legs straight. And I want you to bring your feet up towards you. And I'm going to give resistance. I'm going to be pushing. So go ahead. Go. Bring them up towards you. Good. And push against my hands. Good. Pretty strong. Let me just check your pulses real quick. Good. Radial pulses are nice and strong. Okay, and if you wouldn't mind, could you take off your shoes real quick just so that I can check your pulses on your feet? Have you noticed any swelling of your legs?
No.
Or your feet? Okay. All right. So, good. You don't have any swelling. Let me check your top of your foot here for that pulse. Okay. And then right on the inside here, kind of by your ankle, there's another one. Good. Good pedal pulses. Very good. Okay. I'm just going to clean my hands real quick. Another thing I wanted to look at was your skin and your nail beds. So amazingly enough, your skin can tell us a lot about how much water you've been drinking. Your skin says that you've been drinking plenty. And then cap refills. Okay, let me take a look here. Your fingertips, everything's good. Okay. Any questions so far?
No.
All right. So then moving along, I just want to check some reflexes right here. Bottom of your knee. Okay. All right. They did what they were supposed to do.
Good.
Which was move without kicking me. Okay. So a thing that we look for too is the shape of your chest. And you know, you look pretty well proportioned. You look good. You don't look like you're losing any muscle, that you're wasting any muscle. So the nutrition is real important. So remember doing the 5 small meals throughout the day, right. Okay? And you know, if you like that, then just stick with that. Or if you prefer going back to your 3 full meals, then do that. But it's just very important that you stay adequately hydrated and that you continue good, proper nutrition. Okay? All right. Have you been sleeping pretty good at night?
Yeah.
Okay. All right, so it looks like I have all the information I need. If I can just talk with you real quick, you know, the smoking cessation, you are interested in doing that once we get all of this taken care of.
Yeah, definitely.
That's going to really help you too with your symptoms. You know, quitting smoking, because smoking is just going to put you at a lot of risks for many chronic illnesses. So quitting is going to be a wonderful thing for you.
Great.
And we have smoking counseling, the smoking cessation counseling that you can attend.
Okay.
We have lots of resources, phone numbers, written material, written handouts, and people that you can talk with, okay. Over the phone. The flu vaccine and the pneumococcal vaccine. So it's our protocol to go ahead and offer them to you. I'm going to give you some vaccine information sheets on the influenza vaccine because it is the season for it. Okay. And the pneumococcal vaccine is highly recommended for you also. Okay. So I highly recommend that you do get those as well. Again, continue drinking as much water as you do. You're doing a good job. A lot of patients don't drink that much, and that can lead to a lot of problems. And I would suspect that you would probably be having more problems if you weren't drinking enough water. Okay, and physical activity. When you're able to start being active again, get back to it. Definitely, once these symptoms have resolved or they're under control. Get back into the physical activity, because as you get older, your muscles are gonna start to, you're gonna lose the muscles, and as you age, you just want to stay active. Okay. All right, so I'm going to go let Dr. Lung know about my assessment on you, and hopefully she'll be able to squeeze you on in, okay? Do you have any questions?
No, I don't.
Oh, it's good to see you, Mr. Manolo.
Good to see you as well.
Again, tell your wife I said hello.
Okay, I will.
Okay, thank you.
Thank you.